Hey everyone, welcome back to Forward Therapy. New month, new CHT prep. You know what it is. We are in February of 2025, and I have 10 new free practice questions for the CHT exam for you. If you haven't been here before, welcome. First of all, I have lots of these videos. Let me know what you think after you've been through it, but here's how it's going to work. We will go through 10 practice questions. Go ahead and pause the video, take as much time as you need. Fill out the answers. I kind of jot them down on a piece of paper or on your phone, because then we will, after the 10 questions are up, we'll go back through each question, a rationale for the best, most correct answer available. So without further ado, let's get into it. Question 1. A patient presents to the therapy clinic after a Fuchs injury 6 weeks ago that led to a distal radius fracture. She's making steady gains in digital range of motion and has been cleared to begin wrist range of motion by the doctor recently. The patient now reports increased shoulder pain over the past 2 weeks with active movement and reports that she is now having difficulty putting on her coat and tucking her shirt in behind her back. The pain is also disrupting her sleep. The most likely cause for this onset of shoulder pain is A. Bicipital tendinitis, B. Supraspinatus tear, C. Glenohumeral joint dislocation, or D. Adhesive capsulitis. Question 2. When assessing a 16-year-old football player for a recent elbow injury, valgus and varus stress testing reveals medial joint gapping when compared to the contralateral side. This indicates an injury to which ligament complex at the elbow? A. Radial collateral ligament, B. Annular ligament, C. Medial collateral ligament, or D. Lateral ulnar collateral ligament. Question 3. What type of fracture occurs after a Fuchs injury with a dorsal dislocation of the radius? A. Smith's fracture, B. Bennett's fracture, C. Colles fracture, or D. Galeazzi fracture. Question 4. Due to the synergistic action of extrinsic flexors and extensors, maximum grip strength occurs at what position of the wrist? A. 40 degrees of wrist extension, B. 20 degrees of wrist flexion, C. 20 degrees of wrist extension, or D. 0 degrees of wrist extension. Question 5. In a VC instability pattern that occurs as an ulnar-sided lesion, which of the following is true? A. Lunate flexes, B. Triquetrum flexes, C. Lunate extends, or D. Scaphoid extends. Question 6. A patient presents after jamming their middle finger on a table last week. The middle digit DIP joint is slightly flexed at rest, and upon examination, the patient is unable to extend the distal phalanx. X-rays show no bony involvement. What would be the best plan of care at this time? A. Fabricate a splint that holds the DIP in full extension to slight hyperextension full time for 6 to 8 weeks. B. Begin DIP range of motion exercises. C. Fabricate a splint that holds the DIP in full extension to slight hyperextension full time for 4 to 6 weeks. D. Use a dynamic splint for the finger that supports it in full extension and allows the finger to bend during functional activity. Question 7. In the capillary refill test to assess for compromised vascularity, blanching to the pulp of the finger will occur with pressure, and normal color should return when the pressure is removed within A. 1 second, B. 2 seconds or less, C. 4 seconds or less, or D. 10 seconds or less. Question 8. In range of motion assessment, what finding indicates muscle weakness or adhesions? A. Active range of motion is greater than passive range of motion. B. Passive range of motion is greater than active range of motion. C. Passive range of motion is less than active range of motion. Or D. Passive range of motion is equal to active range of motion. Question 9. A patient is being assessed after a trigger finger release of the third digit. Active range of motion measurements are recorded as follows. MCP 0 to 60, PIP 20 to 60, and DIP 0 to 40. You want to record the total active motion, or TAM. Which of the following reflects the correct procedure? A. 60 plus 60 plus 40 minus 20 equals 140. B. 60 plus 60 plus 40 plus 20 equals 180. C. 60 plus 60 plus 40 equals 160. D. 60 plus 40 minus 20 equals 80. Question 10. What type of sensibility testing consists of being placed in warm water for 30 minutes and is commonly used with children or those who are unable to respond to sensory testing? A. Moberg's pickup test. B. Ninhydrin test. C. Orion's wrinkle test. Or D. Semmes-Weinstein monofilament test. All right, everyone, you made it through. Congratulations. Pat yourself on the back. Go ahead and take this moment to pause the video if you need to. Go back through your answers. Make sure that you feel confident in them. And let's go ahead and back through each of the questions. We'll go through the correct answer, and I will give you the rationale for why that answer is the best out of the available choices. Question 1, correct answer here is D, adhesive capsulitis. These functional activities describe movements that require external and internal rotation, which we know is going to be limited with frozen shoulder. The capsular pattern is limitation in external rotation, greater than abduction, greater than internal rotation. It's also typical to have spontaneous pain, and it does tend to disrupt sleep. It just describes the symptoms, kind of explains the symptoms the best out of all of these options. Question 2, correct answer is C, the medial collateral ligament. The other options, the radial collateral, the annular, and the lateral ulnar collateral, are all parts of the LCL complex, which would be positive for lateral gapping versus medial gapping. Question 3, correct answer here is C, the Colles fracture. The Smith's fracture is the reverse of a Colles, so the radius is going to displace volarly. Bennett's fracture is the intra-articular fracture and dislocation of the first metacarpal phalangeal base, or MCP base, of the thumb. And the Galeazzi fracture is the fracture of the distal third of the radius with a dislocation of the druge. Question 4, correct answer is C. This all goes back to biomechanics. So if that's something that you need to review, kind of get back into that kinesiology, biomechanics, and synergistic movements. Question 5, VC instability patterns. The correct answer here is A, the lunate will flex. So I like to think that the scaphoid, lunate, and triquetrum are 3 little bones that hold hands. This is actually something that I learned in the ASHT review course, and I still think about it every time that I figure out what VZ and DC are. So thank you, ASHT review course, back in, I think I took it in 2018 maybe, or something, 2019, so shout out. Anyway, so if these 3 bones hold hands, the scaphoid always flexes, the triquetrum always extends, and the lunate is sort of caught in the middle, right? It is the follower. It's going to follow whatever bone it's still connected to. So with the VZ pattern and an ulnar-sided lesion, this indicates that the LT, ludotriquetral ligament, is broken. So now VZ is only holding hands with the scaphoid, and the link is broken between the lunate and the triquetrum. So what's the lunate going to do? It's going to follow the scaphoid and flex. Question 6, correct answer here is A. The pathology, the description here indicates mallet finger. Once you have that diagnosis, you know the answer. You're going to hold the DIP in full extension to slight hyperextension for 6 to 8 weeks full time. If there was bony involvement, like a bony mallet, you wouldn't want hyperextension. You would want normal extension, full extension. Question 7, check out those special tests. Remember, this correct answer is B for 2 seconds or less, the capillary refill test. Question 8, the correct answer here is B. The passive ROM is greater than the active ROM. So if that is true, it means that the joint's not the limitation, that we're having trouble with muscle activation, or there are adhesions that are limiting this active movement. AROM will likely not be greater than PROM in any case, unless the patient is guarding with passive, which does typically happen, but that's not a true measure. And if the passive range of motion, PROM, is equal to AROM, it means that the limitation is in the joint, like a contracture. Question 9. A math question. Everybody loves math, don't we all? Anyway, so total active motion, you want to add up all of the motion of the flexion at the joints, which is going to be the second number, right? That's 60, 60, and 40. And then you want to add up all the extension deficits, which looks like it's just 20. Then you are going to subtract any extension deficits from the total flexion motion. And so that's going to be, the correct answer is A, that 60 plus 60 plus 40, and then subtract 20 from that. Okay, last one, question 10. Correct answer here is C, the Orion's wrinkle test. Moberg's pickup assessment is going to look at dexterity and functional sensibility. Ninhydrin is kind of the sweat test, is how I think of it. It determines nerve function. And Semmes-Weinstein is used to determine ability to feel touch with the monofilaments. All of these, except for the Ninhydrin, might be difficult for children that are unable to respond to sensory testing because it requires them to do kind of follow instructions and give you answers. But the description here of being placed in warm water doesn't match the Ninhydrin test. So by limiting all those out, you get the Orion's wrinkle test. The Ninhydrin test is where you trace the hand on contact paper, and then you spray the paper with that Ninhydrin solution, which will react with their sweat. All right, everyone, that is going to do it for February 2025 for our CHT practice questions through Forward Therapy. Thank you so much for watching this video. If you enjoyed it, please go ahead and give it a thumbs up. Subscribe to the channel if you haven't already. I really do appreciate you, all of you. We recently hit 16,000 subscribers, which just honestly, every time I hit another milestone, it just blows me away. So I truly so grateful for all of you. Thank you so much for your continued support and for watching this channel, and really just being awesome and liking hand therapy stuff just like me. So that's super awesome. And sorry to ramble, but I just want to let everyone know how much I really appreciate all of you. And I will see you in the next video.